We're changing from the Australian national standards through to the International Dysphagia Diet Standardisation Initiative because the Australian standards, although excellent and evidence-based, are now 10 years old. We had a review of the uptake of the Australian standards in 2012 and identified that there were levels that clinicians were using, particularly in paediatrics, like a slightly thick, that are not currently included in the Australian standards. These new levels are included in the international standards in addition to new evidence-based material. In addition to that, the new international standards use objective measurement techniques. They are simple and easily accessible, but they provide an objective measurement that the Australian standards currently don't offer. Key features of the new framework is that we have both foods and drinks being described. We have consistent labels. We have a numbering system and a colour system that is consistent throughout the world. It's a system that's used for individuals of all ages, in all care settings and in all cultures. And as I mentioned, it also has an objective measurement system that allows you to check at the time when you give the food or drink to the person that they're getting the right food and liquid for their safety. The Australian system, we're very lucky in that a lot of our terminology, the labels remain the same, but we have some changes with the numbers. So we move from 150, 400 and 900 numbering for our thick fluids through to a 0, 1, 2, 3, 4, 5, 6, 7. We also have a change in the colour system for our thickened liquids, and probably the key change there is that we move from green at level 150 mildly thick, that becomes the green colour moves to a level 4 extremely thick, and that's something that we're addressing through transition labelling and increasing awareness. Yes, there are some new levels that members should be aware of. So we have a slightly thick that comes in before mildly thick, and this is to address thickened liquids for infants and children where the thickness level needs to be thin enough to flow through an infant teat. We also have a new level called liquidised that is the same consistency as a moderately thick, and it is on the food side of the pyramid structure. And then we also have transitional foods. They are not a level on their own but a texture, and they span level 5 minced and moist, level 6 soft and bite-sized, and also regular, and they're often used for therapeutic purposes. Australia transitions to the new IDDSI framework on the 1st of May 2019. We're currently in the prepare phase. We're doing this in a staggered fashion, so it's possible that people may start to see the new IDDSI terminology used in conjunction with the Australian framework, which is best practice for change management. But ideally we're looking for people to be aiming to transition across on the 1st of May 2019. The Australian IDDSI Steering Committee has representatives from the original stakeholder group. So we have representatives from Speech Pathology Australia, the Dietitians Association of Australia, the Institute of Hospitality and Healthcare and Catering, members from industry including Nestle Health Science, Precise Thicken and Flavour Creations, and then also a member from the International Dysphagia Diet Standardisation Initiative.